The rising case numbers in our hospitals and intensive care units also putting some added pressure on our medical laboratories. Joining us now with more on this is Michelle Hoad, the CEO of the Medical Laboratory Professionals Association of Ontario. Good morning, Michelle.
Good morning.
Okay, so I'll start with asking you about the impact these high case numbers are having on labs. What are we seeing happening in Ontario labs right now?
So we're starting to see more tests coming into the lab. I think one thing, the everyday person may not understand is that when you're in ICU, that's intensive care. You need to be monitored. We're looking at function of your lungs, especially around respiratory issues with COVID. We're looking at, other major organ function. That is blood that is being drawn from the patient that needs to be looked at. It's done every 1 to 2 hours if they're not stable. So there's a lot of additional work going into our laboratories. So when we look at the impact of ICU, we need to understand that that's additional tests going every day into our labs.
So I think something people are wondering, Michelle, at this point is, are more people getting tested, or are more people really testing positive? When we're looking at these rising case numbers, explain why we're seeing a rise in cases.
I think what's important to understand is the number of tests being done. If we follow them, you'll see, some days we're at 40,000, some day we're at 50, some day we're at 60. There's still a lot of COVID tests being processed. What's important to understand, and as all the doctors have been explaining to us, is that the variants of concern are different. You're able to infect others much more quickly. So I think just the segment you had on before kind of explained that, with those ICU doctors explaining that we need to be careful. So many tests are still coming into our labs every day.
I feel like we talk about this every week, Michelle, but is staffing still a problem in Ontario labs?
Absolutely it is. So, if we look at our ICU capacity issue right now, I know there's been a lot of discussion this week around what happens when our ICUs get full. What they do is they deploy different healthcare workers to help. Unfortunately, in the lab, it's not that easy. You can't just deploy another healthcare worker to go into our labs to help out with the backlog. So we have understaffed laboratories right now that are dealing with stat coming into the lab regards to ICU that then need to say, okay, well, this needs priority because we've got a patient who's critical, but we also have other patients and other blood work and other types of tests coming into the lab. So there's a lot of work being done right now with people that are overworked, understaffed. It is hard times in our labs.
Okay, I lastly want to ask you, Michelle, about these variants of concern, because that's really the big problem right now, the big challenge for us here in Ontario. So when you get a test at these labs across Ontario, how soon after do you know whether it's the first strain of COVID-19 or some of these new variants?
So that process and all that testing is done. It's actually quite specialized testing. It's done through public health. They're able to grab that data and analyze it. It's a very, very complicated process, but we do have specialized people that look at that information. So I think one thing we need to keep reminding ourselves is, especially with this lockdown that's happening, we all need to take our part in Ontario to ensure that we are doing the right thing, staying home, not infecting others. It's pretty easy to forget when we go out. We may meet someone, we may talk to them. It is so easy to spread what we have right now. Let's be smart about it.
Okay, well, some good messaging there. Thanks so much, Michelle, for your time and your insight. We appreciate it.
Have a good day.
Yeah, have a good Easter weekend. Thanks. That is Michelle Hoad, CEO of the Medical Laboratory Professionals Association of Ontario.